Is walking good for knee pain? This is an interesting question, and I hear clients with different arthritis conditions in the knee, or maybe they've hurt their meniscus, and they say that somebody told them not to walk because it's going to bother their knee, or not to run because it's going to bother their knee. So there's now been multiple studies that show that running specifically does not increase the risk of knee arthritis. And so if running doesn't increase the risk of knee arthritis, well, then I can't imagine that walking is going to increase your risk of knee arthritis. Now, the secondary question to that is if you have knee pain, is walking going to help? And now that's a more complicated question because for a lot of people with knee pain, walking hurts their knee. And so I do think that if you're currently undergoing knee pain, you gotta figure out why it hurts when you walk. A lot of times there is some type of muscle tightness in the hip or the back of the knee or the ankle that's causing that knee joint to move in a way that isn't as natural and is enough to kind of send a pain signal to the brain. And so if you can figure out whatever that is, again, it could be spine, could be hip, could be ankle, could be the muscle in the back of the knee that locks and unlocks your knee. There's a rotational component to a lot of times. But if you can figure out what that component is to take the pain away, I would typically recommend getting that cleared out first, then seeing how far you can walk before you elicit a pain response. At the end of the day, if you have some type of pain, I would encourage you to move it as much, for most conditions, move it as much as you can without making it hurt more than a 4 out of 10. The 4 out of 10 is kind of this generic. If it doesn't get more than that, you're probably okay. So movement is going to help move fluid in and out of that joint, which ultimately is going to help it heal. So you want to move as much as you can without doing so much that you kind of really piss it off. So no more than a 4 out of 10, keep it moving as best you can, and then ultimately try to figure out why it hurts when you walk. And again, if you can find somebody that can help you assess that, but check ankle stiffness and range of motion, check your hip, check your ability of your knee to rotate in and out, and then sometimes look at your back. And usually it's one of those things that's putting increased tension on the knee, which is causing the pain when you walk.